This is Radio Now 95.3 FM. Come for the news, stay for informed conversations.
Nigeria has a rat problem, according to the federal government. The four-legged rodents are responsible for the latest outbreak of Lassa fever in Kaduna State, and that is why the federal government has launched a national deratization program. In simple terms, the federal government will focus on eradicating rats across states that experience consistent annual outbreaks of Lassa fever. This announcement was made in Abuja by the Minister of State for Environment, Isiaq Salako, after an outbreak in Kaduna saw 12 suspected cases of Lassa fever. Now, while the federal government's actions may be commendable, Nigeria has been plagued by seasonal outbreaks of Lassa fever for over 50 years. Our guest on the conversation today is the immediate past president of the Nigerian Academy of Science, a man with vast experience in virology, disease prevention and control. He is Professor Oyewale Tomori. And in this conversation, he starts by reacting to the news of a resurgence of Lassa fever in Nigeria.
I'm not surprised at anything about Nigeria. Nigeria doesn't prepare for anything. We know our problems, but we will not do what we need to do. So I'm not surprised.
Just to give us a sense of what's going on, especially for those who are hearing Lassa fever for the first time, is this something that we should be taking seriously? Is the Lassa fever a problem we should be taking seriously?
This is a problem since 1969. How many years is that? 54 years ago.
That's 64, yes.
Yeah. So, and then we had a big celebration in 2019, I think, 50 years of Lassa fever. We promised ourselves we're going to do great things and this will not occur again. But ever since then, the numbers have been increasing. And then we are still not prepared because, every year you see the NCDC will say, we are setting up a committee to look into Lassa. This is a committee that we know come October every year, the season starts. We don't wait until February before we set up committees on it. That's the problem. And that's why I say I'm not surprised. The October 1, instead of celebrating Nigerian independence, we should use it as Lassa Fever Awareness Day to begin the awareness for our people, because that's when the problem starts, just at the end of the rainy season, the dry season, and then escalates into January, February. And then now we are having what we are getting. Every year we repeat the same thing year in, year out.
Professor, can you speak to the federal government's most recent efforts, deratization, especially in Kaduna State? The goal seems to be to attack the vector itself, the carrier of Lassa fever, the rats. Is that an effective strategy?
Yeah, it has to be. Because when you look at the vector, or the host, the natural host, and it is by contact with human beings that you get it. That occurs mostly during the dry season when the hosts that used to be on the field, they are peri-domestic rats. They are found in the periphery around the house where when there's during the dry season or rainy season where there's food, they are out there feeding. When the dry season comes and we harvest all those things, they follow the food. So we know all these things. We know that this is the way they move and the number increases. And then again, sanitation has become something we don't bother about anymore in Nigeria. So even the rats are even getting smarter now. They don't have to wait in the field to get it. They can get it right next door to your house where the sanitation is there, all the refuse and everything. So we are directly attracting all these rodents into our own homes, and we're getting more cases, more contact with them, and therefore getting more cases of Lassa fever. That's where the problem is. So deratization or whatever they call it is one way, but that's not the whole story. Because you also see that even doctors who are treating these people are dying in the hospitals. So there's used to something called that infection and prevention and control is another aspect. So even if you stop it, people will still transmit from one person to another.
Right. It's a very grim picture, to be honest. And usually when you hear about Lassa fever, you don't hear about it in places like Lagos, unless I'm getting my facts wrong. I know that Edo State was a center for a while. We're hearing the latest cases in Kaduna. But we're talking about sanitation, and you've rightly mentioned that the sanitation that we have, or our sanitation practices, are not the healthiest. Can you paint us a worst-case scenario picture of what happens when we don't take refuse disposal seriously?
First of all, there are 2 or 3 hotspots in Nigeria. Edo State, Ondo State, very contiguous. I mean, those are the hotspots where you find most of the cases. Then you come up north in the plateau, and now Kaduna is adding on to it. So there are a few hotspots in different parts of the country. It's not as if we are all free of it. Lagos also get cases of Lassa fever. But sometimes we don't know about Lagos, whether the problem is that they are imported from other states who come to seek treatment in Lagos. So definitely, but it's all over. And when it gets in there, if the doctors in Lagos are not careful, then they can also get it. So I think we should take it as a Nigerian problem, although we have hotspots. Now, like I said, where you have a lot of farming, initially when it started in Lassa in those days, it was limited to some of those, what you call Sahelian area, where you have a lot of grains and things, And remember the silos for keeping food storage in those days are usually next door to the houses. So that's how, up in the north, we used to have a lot of cases in the north. But now, like I said, with the sanitation upside down, then smart rats now understand that they don't have to wait in the bush to get the food. They can get it right inside your house. So if we don't take care of sanitation, you will see worse things. Maybe you go along our roads, you find that people will be drying cassava, corn right by the side of the highway. All sorts kind of things like that. So we're exposing whatever it is we are putting into the discharges of these animals, urine, feces, and all that. That's where the Lassa fever is shed. And that contaminates your food. So if you eat your food raw, if you don't cook it, like you smoke gari, for example, or people trap rodents. As well, it's not the people who are eating the cooked rodent, it's the man who is on the field trapping the rodent, who is exposed to the blood and to the discharges of who gets the infection. That's the one that brings it into the hospital, and then it spreads from there, or even to his house first, to his family members, but then it spreads from there, and then the hospital, and then doctors and nurses. So that's what's happening. So the foundation is keep your area clean. The rodents won't come near your house. When you have food in your house, put it in the proper covers that are sealed, not just out in bags or cellophane bags or something. They eat through all those ones. You have to have proper container which is covered, locked, so the rats can go there and eat those ones. Those are the basic things we need to be telling our people. Not to frighten people and say don't eat bushmeat. Yeah, the problem is that yes, the bushmeat man, the man who is eating the bushmeat is at the tail end of the spread. The guy who will have gotten it will have been the one who was on the field, who trapped the rodent, who skinned the rodent, the blood came into him and got infected. Not the man who has already is eating the well-cooked meat.
Professor, it's not the first time or the second or the third time that we're hearing about Lassa fever in Nigeria. Why have we failed to end Lassa fever once and for all?
Because we forget the lessons that we learned from the past. We know how Lassa goes. We have information, all the information we need to control Lassa, we have it. It's just that we not take action. And that's why sometimes I get a bit worried about what NCDC, this National Center for Disease Control. But I'm telling them they are probably better off as National Center for Disease Coordination. And let the states and the local governments control the diseases in their area. And then the NCDC will provide support for them. Most of the cases are coming from the rural areas where NCDC is in Abuja. The cases are in my mother's village. So it should be my local government, it should be my state that should be focusing on controlling disease there. And if they control it there, then it can't spread to any other places. So that's why the role of NCDC should be more than that of disease control, but of disease coordination or disease control coordination, in which they empower the local governments, to be able to control it at the source.
Right.
Rather than wait for NCDC to run helter-skelter all over the country trying to control the infection.
So it sounds to me as though the Disease Control Center in Nigeria should be working hand in hand with the primary healthcare facilities that we have in our local government areas.
Exactly, that's the way it should be.
Well, Professor, thank you very much for speaking with us. You are someone who, if I took the time to go through your CV before we started this conversation, I would probably still be reading it out by now. But one thing is clear, as far as Lassa fever, and indeed, I would say you're probably one of Nigeria's most renowned virologists. And it's interesting that we are having a conversation about Lassa fever with the knowledge that you have, I'm more than a little surprised that we haven't actually consigned Lassa fever to our history books. I mean, it doesn't make any sense to me that we're still talking about Lassa fever in 2024. So something is missing somewhere, and I can't seem to lay my hands on it.
You see, thank you very much. You're raising this one. First of all that, whatever you're saying, is all glory to God. My involvement with Lassa fever was one of those divinely guided things. As I'm a veterinarian, that was my first degree, so I had nothing to do with Lassa. It was Lassa broke out in 1969. I was still in the veterinary school. They came to talk to us about some of the team that investigated the Americans. The veterinary school in ABU was run by Americans. So they stopped by to talk to their colleagues and then talk to my class, which was doing virology. And then said, at the end, he said, who would like to work on Lassa fever? Jokingly, I raised up my hand. I wasn't really in the right? Because nobody wants to go and commit suicide at that time. 100% mortality, everybody who gets it dies. Who is going to raise up his hand? But I raised up my hand of fun, typical, whatever, young man kind of thing. But eventually ended up working in a virus lab, which had to deal with Lassa fever. And so you can imagine my own pain. 69 is when I've been involved with Lassa fever, and still no solution. Not because we don't have the people who can do it, but because we have a country that will not look at its own problem and sort it. We would rather wait for aid, we would rather wait for equity, we would rather wait for donation before we solve our own problem. That's the reason why we're where we are today. The experts on Lassa fever, there are many in this country. They're not just me alone. But this same government will probably go and call WHO, who will bring somebody who hasn't got that experience of Lassa fever to come and advise it. Because we don't have respect for our own people. These are some of the issues that are on ground. And so, really, I think we have the solution. We know what to do, but we just will not do it. And probably it doesn't affect many of the the rich and the politicians and so on. So it's of no consequence. But wait for them. We are going to have more problems with Lassa fever in Nigeria if we don't take time. Worse than what we are getting right now.
Speaking of our worst case scenario, is Lassa fever on the same level as a disease that can take out Nigeria's entire population? We don't know if it's 200 million Nigerians that exist, but can Lassa fever, if it's unchecked, take out that number?
Yeah, because of the seasonality of it. Usually it will peg out when the rains come. So if it was a disease that was all throughout the year, because what happens, as I said, is a matter of contact between the man and rodents. Mm-hmm. When the rainy season comes, there's more abundant food in the field, and therefore the rodents move out. And so you begin to see drop in number of cases around the beginning of the rainy seasons, April, May, thereabout, until the next dry season when we can get the upside. So it's not likely to wipe us out. Some will still remain until the next rainy season, before we end up with another outbreak again, And people who get exposed, they probably will have got immunity over a period of time. So, so many combinations will not make it something like COVID or something that can wipe out a large number of people.
All right. So finally, what do the treatment options for a case of Lassa fever look like?
Most of them are actually treated symptomatically because there's no really proven either vaccine or drug for it. And so you find with a few antivirus, ribavirin and all that. But then the thing is that you have to bring the patient in early enough. You don't wait until he's almost getting all the major symptoms of bleeding, kidney problem and all that before you start giving them the drug. So the earlier they come in the hospital, the earlier we detect. And that's why laboratory is important. The earlier we detect, the earlier we come to the hospital, then the easier it is, or even the drugs you have to take care. But as I said, you treat symptomatically. Remember some of our colleagues, some of our doctors who die after doing a cesarean operation on somebody who has fever. Mm-hmm. We've seen a lot of them die, and they actually had Lassa fever. And then they go and operate on them. So this is not the first time. Several occasions, almost every year, we have our doctors and nurses dying after operation on somebody who has Lassa fever. If a laboratory backup had been good enough, you'll have detected that this guy has Lassa fever before you put him into the theater. So laboratory must be beefed up. Disease surveillance, people must report. Community surveillance must all got involved together. When you see this case of fever, you don't know what it is. The first thing to say is malaria or typhoid. But no, if your laboratory backs you up and tells you that it's not malaria, it's not typhoid, then you know what to do after that. But without the good laboratory system, in fact, one good thing, let's say we report about 10,000 suspected cases of Lassa fever in Nigeria. Go and check the NCDC record. We're only able to confirm about 10% of that. So the question in your mind, year out, is what are those things? So you have 10,000 cases of reported suspected Lassa fever. You're only able to confirm 1,000 of it. What are the remaining 9,000? What are they that look like Lassa? Is it something else? Is it Lassa? Or what it is? Those are areas that we need to begin to look at, so that we don't know what to do. But we will not put our money where our mouth is, where our health is, where our future is. We use that money for our politicians and not to buy big cars we cannot make anywhere here.
That was Professor Yewale Tomori, a professor of virology, speaking on the latest outbreak of Lassa fever in Kaduna.
This is Now Breakfast.
This is Radio Now 95.3 FM. Come for the news, stay for informed conversations.